Alright, so our next group are drugs from bacteria. Dactinomycin, or mycin, doxorubicin. These interfere with DNA synthesis. They have a couple different ways that they work. They inhibit enzymes. They form breaks in the DNA strand. They're classic pharmacology, right? They're classified as antibiotics. Nobody uses them as antibiotics because they are super toxic. They are good for killing cancer. And of course your own cells, because that's what cancer it is. And then we have L-spar, which you get from E. coli. This one's really useful because it doesn't suppress the bone marrow. And so most of these are going to be causing myelosuppression. L-spar doesn't, which is nice. It's used for acute lymphoma. Alright, and then we have hormone antagonists. We talked about some of these before. You may remember tamoxifen. It's the estrogen receptor blocker that is used for breast cancer. Typically, after somebody has breast cancer and they have the tumors removed, they go through the radiation. Then they're on chemo for roughly about 5 years. The side effects of this is similar to postmenopausal syndrome, nausea, hot flashes, rash, and sometimes vaginal bleeding. We also have aromatase inhibitors. Aromatase is an enzyme that's important in estrogen synthesis. Arimidex, Femora, these are indicated for breast cancers. And they're actually now preferred over temofloxacin because they are more potent. Alright. We also have Lupron and Zoladex. These inhibit LH and FSH release from the pituitary gland. It's good for use in prostate cancer in males and then advanced ovarian and breast cancer in females. And then Ulexin is used to treat prostate cancer in males because it's an androgen antagonist. And so it's going to bind those androgen receptors to stop the cancer from growing. Side effects, kind of typical of menopause, but it's in males. And so you have males getting hot flashes, breast tenderness, swelling of the breast, impotency, and jaundice. The next group are going to be these antineoplastics with very specific molecular targets. A lot of these are going to work on a tyrosine kinase that you see associated with very specific cancers. Monoclonal antibodies that have been developed to attack very specific cancers. And so like Avastin here binds to vascular endothelial growth factor, inhibits the formation of new blood vessels, so it stops angiogenesis to the tumors, which means it's going to stop the blood flow going there. It's going to slow the growth, and it's used in metastatic colorectal cancer. And you can look through the rest of these if you want anything specific about them, but monoclonal antibodies, very specific for their cancer. And then this group down here that works on tyrosine kinase. Looking at them all together, so you have your steroid hormones that can work in G1, your anti-metabolites, and your alkylating agents are non-cell specific, so they're going to work anywhere. Your anti-metabolites work in S phase, some of those antibiotics work in G2, and then the ones from the plants working on the mitotic spindles. Alright. We're going to stop there and pick up with immunopharmacology in the next section.